12 mental disorders explained in under 7 minutes. Have you ever wondered what it's actually like to live with a mental disorder? Most people have heard terms like ADHD, anxiety, depression, OCD, or schizophrenia. But very few people understand what these conditions feel like from the inside. Psychology has identified many different mental disorders, each affecting the brain in unique ways. Some change how you think, some change how you feel, and some change how you experience reality itself. Here are 12 mental disorders explained simply. 1. Anxiety disorders. Imagine constantly feeling like something could go wrong, even when everything seems fine. Your heart races. Your mind jumps to worst-case scenarios, and relaxing feels almost impossible. That's what anxiety disorders can feel like. These disorders involve excessive fear, worry, or nervousness that interferes with daily life. Common types include generalized anxiety disorder, panic disorder, and social anxiety disorder. 2. Major depressive disorder. Depression is far more than feeling sad. Imagine losing interest in things you once loved. Getting out of bed feels difficult. Simple tasks feel overwhelming. And even good moments feel emotionally distant. Major depressive disorder affects mood, motivation, energy, sleep, and overall quality of life. It's one of the most common mental health conditions in the world. 3. ADHD. Imagine trying to focus on something important while dozens of thoughts compete for your attention. You want to concentrate, but your brain keeps pulling you somewhere else. ADHD affects attention, impulse control, organization, and time management. It's not laziness. It's a difference in how the brain regulates attention and motivation. 4. OCD. Most people think OCD is just being neat, but it's much deeper than that. Imagine having a disturbing thought that won't leave your mind. And the only way to reduce the anxiety is by repeating a behavior or ritual over and over again. OCD involves obsessions and compulsions that can become exhausting and disruptive. 5. PTSD. Imagine surviving a traumatic event, but your brain keeps reliving it long after it's over. A sound, a smell, a memory, and suddenly it feels like you're back in that moment again. PTSD can develop after experiencing or witnessing trauma. Symptoms often include flashbacks, nightmares, anxiety, and emotional distress. 6. Bipolar disorder. Imagine your mood swinging between two extremes. One period filled with energy, confidence, and impulsive decisions. Another filled with exhaustion, hopelessness, and depression. That's bipolar disorder. It involves episodes of mania and depression that can significantly impact daily life. 7. Borderline personality disorder. Imagine feeling emotions at maximum intensity. Relationships feel incredibly important. Rejection feels unbearable. And your emotions can shift dramatically within a short period of time. Borderline personality disorder affects emotional regulation, self-image, and relationships. But with proper treatment, many people learn to manage symptoms successfully. 8. Schizophrenia. Imagine hearing voices that nobody else can hear, or becoming convinced something is true even when others insist it isn't. Schizophrenia affects how a person thinks, feels, and perceives reality. Symptoms can include hallucinations, delusions, and disorganized thinking. Despite popular myths, many people with schizophrenia are not violent and can live meaningful lives with treatment. 9. Autism spectrum disorder. Autism is not a mental illness. It's a neurodevelopmentally condition. People with autism often experience the world differently. They may struggle with social cues, prefer routines, or develop intense interests in specific topics. Because autism exists on a spectrum, every autistic person is different. 10. Eating disorders. Imagine looking in the mirror and seeing something completely different from what others see. Eating disorders involve unhealthy relationships with food, weight, and body image. Common forms include anorexia, bulimia, and binge eating disorder. These conditions affect both physical and mental health and can become life-threatening if left untreated. 11. Dissociative identity disorder. Imagine feeling disconnected from your own identity, as if different parts of yourself take control at different times. Dissociative identity disorder is often linked to severe childhood trauma. It involves two or more distinct identity states and remains one of the most misunderstood psychological conditions. 12. Substance use disorder. Imagine continuing to use a substance even when it's damaging your health, relationships, finances, or future. Substance use disorders involve compulsive use despite harmful consequences. Addiction changes how the brain's reward system functions, making quitting far more difficult than many people realize. Final thoughts. One thing psychology makes clear is this: mental disorders are not personality flaws. They're not signs of weakness. And they're not something people choose. Behind every diagnosis is a real person facing challenges most people never see. The more we understand mental health, the better we understand each other. Which of these disorders surprised you the most? Let me know in the comments.